Queensland has recorded one new case of coronavirus today that authorities say is likely historic and not related to the doctor who tested positive yesterday. All contacts of the doctor have been identified and testing is underway. For more on this, reporter Jessica Rendell joins us now from Brisbane. So Jess, how many people came into contact with the doctor as far as we know?
Well, we know that 238 people have been identified as community contacts with this doctor, and testing is underway for those people there. Contact tracers have been into the PA hospital where the doctor worked, and they've identified 61 staff members and 7 patients who may have been potential close contacts with the doctor as well. Now, they've all been tested, and we're just waiting on those test results to come back, which should come back to us tomorrow. In total, 5,026 tests were conducted in the past 24 hours, with only that one positive test there, that case that they believe is historical. Now, 3 close contacts have been identified with this doctor, but they've all been tested and they've all come back negative as well. Now, the patient who they believe might have given the virus to this doctor was staying at the Hotel Grand Chancellor. Now, you might remember the name of that hotel from a previous lockdown in Brisbane earlier this year that was associated with a hotel cleaner there. Now, they believe the hotel, is now in lockdown. The patient tested positive on day 12 of their stay there, so they believe that there could be some transmission in the hotel there, so they're exploring all of those avenues. Here's what the Health Minister had to say about that.
It is going into lockdown as we speak. What that means is that there'll be no new hotel quarantine guests brought into that hotel. They will be put in different hotels, and none that were due to leave in the next couple of days will leave until we have the opportunity. We now have CCTV on these floors. It's not the same floor. It's not the same sequencing as last time. So let's be clear, it has no relationship whatsoever to the previous cases.
Yvette Darth there. Now, Jess, in relation to that case involving the doctor, there have been questions raised about the type of PPE that the doctor was wearing. Has that been clarified?
The Health Minister was asked, but she did not clarify what type of PPE the doctor was wearing. Queensland health guidelines don't actually mandate the use of N95 or P2 masks currently. So there have been some queries around whether or not those guidelines should be changed. The Health Minister said that we are following national guidelines and restrictions, but we did see recently Victoria change their own guidelines after their situation down there, and they've included mandating N95 and P2 masks. Now, I did ask the Health Minister if that was the plan for Brisbane here, but unfortunately she did not provide me with an answer. She said that that's an avenue that they're exploring and they're still looking at.
Okay, our reporter Jessica Rendell there with the latest in Brisbane.